So this is our second virtual town hall, and for those of you who uh, came last week, welcome back. For those who are here for the first time, welcome, and I'm so glad you're here. Thanks for taking the time during lunchtime to help build community here and to see what the updates are for CIH and for COVID-19, and basically how we can all move through this together and to help our health. So this is what we're going to cover today. We're going to just cover, we're going to do a little check-in here, doing right now. So again, thank you for coming here today. We're going to do some of the updates over the last week on COVID-19, some of the research that really has been published in the last 7 days, and also some of the connections in terms of using functional medicine as a way to connect all the systems of biology, because really COVID-19 is not just a lung issue, and that's what I've been reading about and wanted to share that with you. And it's actually more of a systemic issue that we need to look at all different biological systems in order to effectively address that. We're going to also talk about updates on CIH services, clinic services, and reopening date, and some of the services that you want. So this is going to be a huge factor, in terms of this town hall right here, in terms of your responses are going to influence what we do. And this is, as we said last week, it's a patient-centered practice. We want to be of service to you always, and this is our way of doing that. And then we'll have, I think, enough time at the end for some open forum and Q&A. So if you are new to Zoom, you can type in the chat box here. Hey, Jackie, great to see you again. Welcome back. You can type in the chat box questions. I believe that you can also raise your hand. That's what we did last week. I'm a little new to this still, so I will also still apologize if I have any technical difficulties. I'm still learning this too. But you can also raise your hand in Zoom, and then we can call on you, and you can speak, and we could do that at the second half of this. So I think we can go to the next slide. So first of all, updates on COVID-19. So there are some NIH opportunities. There's a clinical trial. This is not really an opportunity necessarily for us, but we're going to follow this very closely. One of the big medications that's been used, even in local hospitals as part of their protocol with limited trial data, is something called HCQ, also called hydroxychloroquine. Some people know it as Plaquenil. That's the brand name of that. It is used for patients with autoimmune conditions such as lupus or rheumatoid arthritis to reduce inflammation and to help the immune system. But it can also be used as an antimicrobial in many cases, and it's used kind of off-label by doctors for that reason as well. So an NIH trial was done or started just a couple of days ago on the 9th of April in hospitalized patients with COVID-19 and at Vanderbilt. So that's being done as part of what's called the ORCID study, which is a study that's done in hospitalized patients with COVID. So there will be a link in the chat button that Jen can share, and you can go to that link and kind of look at that announcement. Now, the NIH locally is also enrolling healthy volunteers for COVID blood testing that will drop ship to your house. That's a 10,000 person study. I know that a couple of us at CIH, including myself, have emailed them. I haven't gotten a response back from them yet, but I'm sure that they will, and they do need volunteers for that. So this is people that are healthy volunteers that don't have any COVID symptoms. We want to see, what the prevalence of coronavirus is in the population of people that are not having symptoms. In clinical studies, so far it's been shown that up to 25 to 50% of people that are asymptomatic, that don't have any symptoms of coronavirus at all, actually have blood tests showing that they have immunity towards COVID, meaning they were kind of exposed and their immune system kind of took care of it without them having symptoms. So we'll include a link in the chat to that as well. And then we can go to the next. So then I want to talk to you about testing updates, which are coming down the pipeline. These are kind of probably be ready in a couple of weeks here. They're not officially used for diagnostics. So the one thing that that has been considered the gold standard for a diagnosis of coronavirus is something called an NAT test or nucleic acid test, which is either a swab of the nose or the mouth, or if you're in the hospital, a swab of the lungs. But these are considered the gold standard. So there are other tests that are out there that we're going to have to use as a society moving forward, I think, in the future to demonstrate immunity, to demonstrate that either someone's had a vaccine, down the line 12 to 18 months from now, hopefully, or they've been exposed and they've recovered and they have immunity towards that based on antibody testing being positive. So there are certain tests such as Ray Biotech, KBMO, and Vibrant. You can read the screen there. And there are certain antibody tests that we can use. We're going to definitely have one called Ray Biotech that's coming to the clinic that we'll be able to use insurance for. And it's basically we'll have our medical assistant do a finger prick of your finger, and then you can tell in about 10 minutes if you've been exposed to COVID based on that. And that test has about a 95% sensitivity, as well as a 91% specificity. So basically, if someone is really positive in terms of having immune markers, you have a 95% chance that will detect that, which is a good number. And then there's also some in-house blood-drawn finger prick that also could be done, that we're kind of exploring as well. And then there is one that they're trying to work on, Vibrant is trying to work on, and still haven't got FDA approval for, but they're going to hopefully know within the next 1 or 2 weeks, and that will be able to be drop shipped to your house. So if they do that and they get approved, we'll be offering that to patients. I think that one is a cash-based test, about $150. And then LabCorp, I spoke to them yesterday. They're also working on antibody testing. They do have sort of the nasal swab testing available, and we can talk about that. But they are working on blood tests for antibody testing. And then there's also an interesting test called the stool test. Now, some of you may know from doing functional medicine testing of the gut microbiome to look at your bacterial levels, good bacterial levels, and things that are considered more inflammatory bacteria. But this DSL lab, which is called Diagnostic Solutions Laboratory, actually came out with a test called the COVID-19 PCR test. So to look at copies of the COVID DNA in stool, because as I'll explain to you a little bit later, the stool, the colon and the gut in general is actually one of the potential big reservoirs for coronavirus. So we're going to have to look at this not only from a lung perspective, but also from a more functional medicine, a more whole systems perspective in terms of where coronavirus might actually be kind of setting up shop in the body, so we can treat that more comprehensively. So these are not officially used for diagnostics per the FDA guidelines, but they could be helpful clinically. And we'll go to the next slide here. So this is my favorite part so far of these Zoom webinars, is asking you questions so that we can be of service to you. So this is a polling question, which I'm a little better this week than last week, so about learning how to do this. So I'm gonna share this with you. So the question is, do you want in-clinic lab testing, either blood draw or finger prick? And let me just, for COVID basically is what that's for. So we're gonna launch the polling, and feel free to vote and share your votes there. And thank you for voting. Great, I already passed the 50% mark again, better than the US general election, I think, usually, so congratulations. Thank you for voting and offering your opinion on this, because this is really important information to figure out, when and, and what kind of tests we want to offer to our patients, and to be of best service to them at this time. So looks like 79% have voted, which is great. Thank you so much. And I can give you a couple more seconds here. I think we're good. So I will go to end polling. Yeah, so the ones that are at home are not going to be covered, Margaret. Thank you for the questions. Sarah, and then also on the for Margaret's question, the COVID test we're going to submit to insurance, the one that's it's called Ray Biotech. That one's the finger prick test. That's the rapid test. We can submit that to insurance. And then, and honestly, I'm not sure if it's going to be covered or not by insurance, but I think there's a mandate to say these tests should be covered now. I think the administration said that, so I would imagine they wouldn't deny it, but I don't know all the insurance behind the scenes things. They've kind of said in the past that they would cover these things, so hopefully we hold them to that. But that one will be submitted to insurance. Some of the other functional labs that are doing this are definitely not covered. They're cash, so the ones that are shipped out to your house and stuff like that. The stool test would also be, yes, 95% accuracy on the Ray Biotech. How accurate are the home tests? They've all done their own in-person validation. FDA has still to validate them third party. Thank you, Laura, for the question. They're all above 90%. A lot of them are actually at 95%. Certainly I think there is that concern about someone coming to your house and, they're obviously going to use PPE. They're more of an outside contractor that is not officially affiliated with CIH, but they're affiliated with a lab company. So, it'd be one person coming to your house if they did that. I am waiting for the finger prick test. I think that would be exciting because that's something you could just do at home and they could mail it to you, and no one's really drawing your blood at that point, but you're just kind of doing it yourself. I think hey Sarah, great to see you again. I believe we can ship it out to California. I don't see why not. So I will end polling and let me share results. So 79%, so basically 95% are either yes or maybe. 79% yes, you want some lab testing to be offered at CIH to see what immunity status that you might have. People are interested also in more the at-home testing that's shipped to you. That would be a cash-based test, but they're still waiting on FDA approval. As soon as they know, we'll let people know, and then we can ship that out to people. And then a few people, about a third of people, are interested in either blood draws at the home or this stool test that is drop shipped to you. Okay, thank you. And then let's see, we can go to the next one there. So again, the gold standard is still this nucleic acid testing, or NAT. And this is also based on hospital protocol, but the validated sample types for COVID are either swabs of the nose or mouth. It doesn't have to be both, either one. Or in the hospital, it'd be things like bronchoalveolar lavage, which is a sample using a bronchoscopy, using basically a camera that looks at the upper airways or the lower airways. So interestingly enough, for NAT testing, which is, again, these nasal swabs, validation testing is underway, but it's not yet available. So we don't really know the sensitivity or specificity of these tests. Now, some other studies have been done on this, for instance, in China, and they've shown about a 70% sensitivity. So it'll catch COVID 70% of the time, but it's possible if the organism is too deep in the nose or something and the swab can't get to it, that it will miss it 30% of the time. So that's why some other tests like antibody testing or even stool testing could be helpful for people. Right, so we'll just go to the next slide there. So guidance, so we're talking about, talking about if someone had coronavirus and had a positive NAT, then they could repeat testing. But usually it's not recommended if someone doesn't have symptoms, if they're getting better, is really all we need to say about that, I think. We can go to the next slide. And we'll have all this recording and the slides up on Facebook and other sites so you can take a look at it. So antibody testing, which is the Ray Biotech and some of the other tests that we talked about. So IgM, which is the immunoglobulin M, that turns positive after probably about 3 days. That is the more early antibody, sorry. So early antibodies are your acute phase response in terms of your immune system kind of putting on the red alert and having that first responder, so I would say IgM is kind of like your EMT, ambulance kind of situation. So the IgM will go out and it'll help to kill off some of the virus that is kind of early on detected. And then later on, there's a more IgG response, also both by the B cells, and that may turn positive after about 8 days based on previous research based on coronavirus and other similar viruses like SARS-1. So, it may be something where if someone had symptoms right in the beginning of day one, you may not want to test right on day one, but I think most people be, symptomatic for a couple of days before wanting to do that. Now, this would be, if someone is asymptomatic, I think this would be fair game, because if they were exposed, they would have already had probably IgM and IgG at that point. Now, because some patients may have, like I said, undetectable virus based off of a nasal swab, and it may be missed up to 30% of people, serology can be used evidence that the patient has been infected or has been exposed to the virus at least. And then also patients that have had a negative swab but still have symptoms could also be tested. So it's an alternative way of testing. However, there's not any data showing that if you have a positive antibody test, that someone is functionally immune to the virus. So you could have antibodies, which should, in theory, mean you're less able to transmit it. In theory, it means that your immune system is developing, quote unquote, immunity to the virus, but there's no studies proving that yet because it's such a new virus. And then finally, serologic tests have been largely studied in people without diminished humoral immunity. That means people that have a normal, robust antibody response. So in some studies, they've actually shown that about 75% of people have a good immune response with positive antibodies and a very robust antibody response to the virus, but 25% have a weak to zero response, about 20% weak and 5% no response to COVID. So in other words, people could have a negative antibody response, but if they're already immunosuppressed, you have to take that result with a grain of salt, because they might not actually have as high of an antibody response, which would also imply they likely would not have as much of an immune response in terms of ongoing immunity. Other studies I've been reading about have shown that if someone really does have strong immunity, though, and has been exposed and has kind of gotten over that and survived that, then immunity, based on other coronaviruses and SARS and things like that, that immunity for people with a robust response will last up to 1 to 2 years. So that is hopeful. And there's obviously going to be more research and data on that, so we'll kind of do that. Now, going back to we can go back to forward to the next slide. That's great, thank you. So let's talk about a functional medicine or a systems biology approach on COVID. So which systems are affected? So we know the lungs are affected. We know that lung inflammation leads to lung failure in a certain group of people that cannot stop the inflammation. So lungs are very important here. And we talked last week a little bit about how to reduce lung inflammation, how to reduce overall inflammation, and also how to reduce what's called cell-free hemoglobin, which means that to protect the iron in the hemoglobin from leaking out, essentially, and causing lung inflammation. We can review that later if you'd like. We also want to talk about other symptoms that would impact the response of a person to COVID-19. So first of all, the immune system is going to be huge, obviously. So it's not only about the pathogen, and this is what we do in functional medicine. It's not only about the pathogen, but it's also about your immune system's response. So, we're exposed to viruses, bacteria, and everything pretty much on an ongoing minute-by-minute basis. Anytime you're walking anywhere, even before COVID, and you're in the grocery store, you're at a concert or something, right? You're going to be exposed to bugs. You're on an airplane flying somewhere across country. You're going to be exposed to bugs. So why didn't everyone get sick, right? Because everyone is exposed to germs. So the reason is because your immune system. So your immune system is going to have things like natural killer cells and T cells and B cells, which are going to be targeted towards different organisms to make sure that they don't cause inflammation. So the immune system is very important, and boosting the immune system with things like sleep and stress management, and also social distancing, obviously, to reduce the exposure right now makes sense. But also different herbs, different vitamins can be done. In terms of, I think Laura had a question which I can talk about, just repeating ways to reduce lung inflammation. I would say in terms of the root cause, if it's related to virus, you want to actually reduce the viral replication. So you can do things like N-acetylcysteine, you can do things like zinc. You can also do things to reduce cell-free hemoglobin, which is going to be vitamin C. You can also do some herbs, which we can talk about later, but some of my favorites include astragalus, oregano, and andrographis, for instance. So there's ways to increase the immune system. And I would say from a food perspective, obviously eating fruits and vegetables, helping from an antioxidant perspective, as well as mushrooms, like shiitake mushrooms, oyster mushrooms, stuff like that. That's going to increase your natural killer cell activity. So all that could be under immune system. And then, making sure you're having healthy air purifiers, and also getting outside. Digestive system. So let's talk about that, because the interesting thing is, and the cardiovascular system. So I think, is that in the next slide, Jen? We can look and see. Not yet. Okay. So go back a little bit. So in the digestive systems, you basically have something in the lung called ACE2, which is angiotensin converting enzyme 2, and that's a protein that sits in the cell membrane of the lung. So what the COVID virus does is it has this thing called an M as in Mary, M spike protein, and that M spike protein. So if you imagine coronavirus like a ball with spikes on it, right? The ball is a virus and the spikes are the protein, or the spike protein. So the M spike protein actually goes and attaches to the ACE2, which is functioning as a receptor protein on the outside of the cell membrane of the lung. So what happens is that attachment of the M spike protein attaches to the ACE receptor, and then it allows the viral entry into the lung cell. Now, what people don't really understand or realize necessarily is that, but you will now, is that the digestive system, especially the small intestine, is actually the #1 organ that produces ACE2. So there's actually more ACE2 enzymes and more ACE2 proteins in the digestive tract than there are in the lungs. So the reason that's important is because we know from other studies from China that after someone's cleared out the lung infection, after they've been NAT negative, after they don't have symptoms of coronavirus, they still have positive stool DNA tests. They still have positive stool for coronavirus, which means that it's possible that the gut is acting as a reservoir for coronavirus because there's so much ACE2 in the small intestine. We can talk about that later if you have questions about that, but you can see things like nausea because ACE2 is also in the stomach. You can see things like diarrhea because it's in the small intestine, large intestine. So we have to have a healthy gut microbiome. We have to have a good digestive tract and a good immune system in the digestive tract, where most of your immune system is actually in your digestive tract, in order to conquer COVID, I believe. And we'll talk about digestive system. So in the cardiovascular system, I think the big thing here, the big takeaway is circulation. So #1, you need a healthy circulation. You need to keep exercising, keep moving your body. You need to keep drinking water to hydrate your body and to circulate your body to increase what's called nitric oxide. Nitric oxide is a substance that your body naturally makes that helps open up your arteries. But if you think about your arteries as like your superhighway, right, for your immune system, because your natural killer cells and your other parts of your immune system, the other cells that are going out with little, guns and bullets, in terms of the antibodies and trying to kill off this virus, they're not going to be able to get there if there's no superhighway for them, if that superhighway is compromised by decreased circulation. So you need a wide superhighway, so to speak, circulation to allow that fluid to get into all parts of your system, your brain, your heart, your gut, and your lungs, in order to get the immune system to where it needs to go locally, traveling that superhighway of the cardiovascular system. So nitric oxide is big because over age 40, nitric oxide production drops by 50%. And that kind of goes down each decade. So we want to make sure you optimize nitric oxide. There's ways to do that naturally. You can do that with sauna. You can do that with a hot bath or something where you're sweating. So that would help a little bit with nitric oxide. You can also do that with exercise. You can do that by eating certain foods like green leafy vegetables, especially beets and other green leafy vegetables, which can increase nitric oxide. And then you can also do that with supplements to help with nitric oxide. But I think that's really important because nitric oxide has also been shown in other independent studies to actually be antiviral. And it actually has been shown to be helpful for viruses also. So it actually has an antiviral effect too, which I didn't know about. So that was interesting to me. But all of these systems are playing together and they're connecting together to help you. So we have to address all systems, not just the lung. And that's our functional medicine perspective on COVID. And we'll have some questions at the end, I'm sure, about this, and we can go into more detail about this. Thank you, Jen. There's some more polling questions, so we'll go through this quickly. We talked about this last week and a little this week. So zinc, vitamin C, others that, whoever your healthcare practitioner is, I would say, talk to them about these things. Hopefully they're knowledgeable about these things. You want supplements that support your own immune health. These things are helping your own immune system. They're not magic bullets. They're helping your own immune system. So I'll just give you an example. Is vitamin C actually helps your natural killer cells and your T cells and B cells mature. So you can have a bunch of immune cells in your system, but if they're immature and they're not ready for prime time in terms of fighting off infections, they're not going to be of use to you. So you want to actually go from a immature immune system to a mature immune system, and you want to have maturation of your immune cells so they're ready and they're putting on their uniforms, they're ready to kind of fight and, fight for you. So vitamin C helps you do that. And also in the case of viruses, it's well known that viruses actually increase your need for vitamin C by 10 times the amount you normally need it. So the reason is because the white blood cells need vitamin C to function optimally, to mobilize. It's kind of like juice for your immune system. So again, vitamin C is not really directly killing off the virus. Vitamin C is helping your own immune system be better and be stronger to fight off infections. So we have supplements, some at our clinic. Until we reopen again, we can ship to your home. We could probably still ship, after we reopen. We can talk about that in a little bit. There's also a good coronavirus support or CV support formula by Woodland Essence that we have, as well as a circulation supplement that we also use for hypertension and along with medications, of course, and other situations. But I would say cognitive issues too, brain issues, but then also for increasing circulation, at this time. And we know that nitric oxide, by boosting that, it actually has its own antiviral and immune boosting effects as well. Thank you, Lori, for the question. What level of vitamin C supplementation do you recommend? It depends on the person, but I would say as long as you don't have a history of kidney stones or what's called G6PD deficiency, I would say 1,000 would be very safe. Probably 1,000 to 2,000 milligrams a day is a good starting dose. If you feel like you're getting sick or having symptoms, you want to go up to 5 to 10 grams a day of that nature. So we can go to the next slide. There's a couple other. So Smile Herb Shop is a friend of ours. They're out in the community, and they're located here in Maryland, and we're working with them on creating a formula with skullcap and Japanese knotweed and kudzu, licorice, elderberry, things that are going to help improve your T cells and your overall immune system, natural killer cells. Cordyceps, donquai, rhodiola, astragalus, again, good for Th1 response. Danshen, which is a Chinese herb, as well as red root and cinnamon bark. So they have a system where they can actually customize a herbal formula. So this herbal formula will be helpful for coronavirus, and they've given us a discount code. Thank you very much, Smile. I think you're on the call probably, so thank you very much. Discount code of CIH20, which I think is 20% off that. And Yolanda, thanks for the call. Thanks for that comment. We are working on that, and we will announce that ASAP in the next couple of days. And then the compounding center is also a friend of ours. Thank you, Jay, for offering this too. Jay Gill is the owner there, so thank you so much. And Leesburg, they can ship hydroxychloroquine to people, especially if you have lupus or you have RA, and the national supply is dwindling because everyone's putting a run on this. I want to make sure that HCQ is first and foremost used for the proven conditions like lupus and RA, and I'm sure we have some. I know we have some patients that have these, so we want to make sure that this doesn't run out for them, so that they don't. They need it and they don't have it. So there is a compounded ACQ that the compounding center is offering for $65. Now, ACQ is being utilized in multiple trials for COVID-19 and is ongoing. Like I said, there's an ORCID study. There's also a study at Henry Ford Hospital in Detroit that's looking at frontline healthcare workers, and and that's more for prevention. So it's being utilized for both prevention and treatment in multiple trials. And I think the evidence, the jury's still out there on whether or not it helps everyone. I believe that it's going to be helpful more to people that are early on in the disease process, because it helps to prevent viral fusion to the cell membrane. So I think once it's fused to the cell membrane, causing a lot of lung inflammation, that's a whole other ball of wax there. But I think it could be considered as possible therapy for symptomatic patients that are at higher risk based on exposure. Or COVID-19 positive patients, obviously, that would be something that hospitals are already using right now, is hydroxychloroquine. Deborah had a great question. Thank you for asking that too. And also, Lori, I'll address that. So first of all, the risks. So there are some heart risks in connection with HCQ. I think the most common side effect is diarrhea based on studies, but there is a heart risk for people that have a genetic condition called long QT syndrome. If someone has long QT, which is you look at on an EKG, they might be more predisposed to arrhythmia. I think there are risks, and I think anyone that uses this medication, there is that risk-benefit analysis you have to kind of go through, and I think there's some tough choices right now on whether or not to use that, without um, knowing about your EKG status. And that being said, I mean, it's relatively uncommon, but I think you do have to consider that. That's a great point. And in terms of the quercetin, Stacy, we can answer that offline, I think. For the quercetin question, quercetin can be used instead of HCQ. I mean, obviously, and I can just say this again just to make sure. Thank you for the question, Deborah. Quercetin as a supplement, the FDA guidelines say that supplements are not, or vitamins are not intended to be used for prevention and treatment. So really what we can say is that supplements can be used to boost the immune system. They may be used for that. So I think we could say that. Quercetin has been shown in some trials to be helpful for COVID though. Let's see, and yeah, rough on the retina. So someone that's taking hydroxychloroquine long-term would want to see their eye doctor or ophthalmologist twice a year. I think short-term, I don't think the data is necessarily showing that that's harmful, but I don't think there's any studies yet on short-term use really anyway. I'll try to answer some more questions, but let's go to the next slide because I want to make sure we get to the polling questions. We also know that air filters are important. So we have now a page, I believe, that we're going to put live after this, cihealth.org/airfilters. So we kind of did this because we realized that total body health is not only about what's inside of you, but also what's outside of you. So, if you live near a highway or something, if you're around a smoker, these are problems for your lungs. And, having vulnerable lungs is going to make you more predisposed to COVID. So air filters are a great addition to your room or office. I just got one called Air Doctor, recommended by Dr. Hyman. There are other air filters at different points there that you can kind of look at, but they're great to improve toxic load in the environment, or reduce toxic load in the environment, different viruses, dust particles, and things like that. It's really useful for people with allergies, asthma, chemical sensitivities, but also for general immune health. Now, no air filter can completely filter out virus particles, but can help via a zigzag motion called Brownian motion. So if you just Google Brownian motion, you can kind of learn more about how air filters work, HEPA air filters work. And then you can visit our page to kind of, Jen, thank you so much for doing this. This is amazing. She put together pros and cons of different air filters that are available and different price points and stuff. So I think that's great. Thank you so much, Jen. And you can check out our page there. And then now I want to talk about updates for services at Capital Integrated Health. So a very important part of this talk today is what we're going to be doing in the near future based on, in large part, your response last week. So thank you for everyone that came last week and voted on when to reopen the clinic, how to be of best service to you. So we can go to the next slide here. So we are going to open on a limited basis Monday, April 27th. We're obviously still available for telehealth for both established patients and new patients. So we're doing a lot of that, both on the medical and nutrition side. And then we can talk about a lot of services here just in a bit. I will be personally in the office for any visit that needs to be done in person. We do want to try to still do our part for social distancing. So if you have something that is not considered, something like a lab review, let's say, we would probably still want you to do that over the phone, or over the video, sorry, on telehealth. But anything that needs to be done in person, I'll be there for that. We have protective equipment. We have masks for you if you don't have a mask. We're going to wear masks ourselves so that we can be safe and that you will be safe. We'll also be opening back up IV nutrition, and that's going to be a little different than what we did before. We had before 3 to 4 people in the room, and that was kind of nice. People were chatting with each other, talking with each other. I think now with COVID, at this point, we're going to just limit it to 1 patient, and then we'll have Laura there, our nurse, also to give you IV therapy to help boost your immune system, but it'll just be that 1 patient in a room. We haven't decided yet whether or not we're going to have other patients in different rooms, but I think in any case, it would just be 1 patient per room. And then we'll also have our LabCorp tech there, Tasha, who will be back on the 27th to do lab work draws, which could be any kind of lab draw. It doesn't have to be COVID lab draw. If you need your thyroid checked, because you're kind of out of date on that, you need to figure out how to adjust your medication. If you need liver tests or anything like that, we'll be available for that. Deborah, question. We are not treating COVID positive patients with IVs. at this point. I think there is a risk to the community if we do that, if we introduce that, to our clinic. So love to hear more of your feedback on that. Feel free to open it up with a comment on the phone here at the end of this talk, and we'll have some ample time for discussion, I think, here. So yeah, I'd love to hear your perspectives on that, both pro and con about that. I think we're trying to treat people more for prevention and people that are not symptomatic and things like that at this point with IVs. So then which services would you like to see reopen at CIH soon? So this is going to be the second question. Let's see, I think I did the wrong one. Okay, so yeah, here we go. Okay, so which services or procedures would you like to see reopen soon at CIH? And I think, CIH patients, please vote on this. And I'd really love to hear, and I think everyone's pretty much, a lot of people are, so we will see what the results are there. Thank you for voting again on this. So I'll read this out in case people can't see the screen, but the services we've kind of put as choices. So we're definitely opening up medical appointments. Nutrition, in terms of Katie and Jen, they're still gonna be off-site doing telehealth. So they're still open, they're still available, but I think for nutrition, it makes sense to still do that via video, via Zoom. Same with medicine, we'll do it mostly on Zoom, but like I said, I'll be there in person if someone needs to do something in person with me in terms of medical visit. So we have IV nutrition as an option for the selection. We have blood work. We have acupuncture. We have body work, including things like myofascial release, body memory recall. We have sauna, red light therapy, which helps boost the mitochondria and immune system, brain mapping, and neurofeedback. So all those choices there. These are things that are mostly procedures that would need to be done in person. So we want to kind of prioritize and see what people would want to do and be of best service to you, like I said. While you're voting, let's see. Hey, Nicole, great to see you too. Thank you for the question. And Angela, let's see. I think for Nicole's question, how much zinc is too much? I would say you wouldn't want to go over 50 milligrams. That's a pretty high dose. 30, 35 seems to be fine. I think you do want to check if you're at 30, 35 or more. You want to check blood levels in about 2-3 months or so. Is liposomal C better? I think there's some controversy over that. I think some studies show it's better, others it's not really sure. So I think whatever vitamin C you have is better than not taking it for most people. If you have liposomal, then I think it's good to take 1,000 to 2,000 a day on that. Angela asked about, is there any data showing that IgG supplements are helpful to boost your immune system? Colostrum, I don't think against COVID-19 directly, but colostrum or something called SBI, serum bovine immunoglobulin, which is dairy-free. IgG, I have seen just clinically with experience with people that are on IgG supplements like colostrum, they don't get as many infections. And I think what happens is your IgG, and especially your IgA, which is also in colostrum, gets boosted. And that IgA is directly antimicrobial. The IgA, which goes to the mucous membranes like the lungs and the gut, it actually helps to prevent infections. So I think that's a big, that could be a big recommendation. Thank you for bringing that up. So I think there's still some people. Okay, so I'm gonna end polling unless other people wanna vote here. We're at 62% here. Hey, Mustafa, great to see you. Yes. Evelyn, great to see you. Ellen, like acupuncture, thank you. Zinc, I like zinc picolinate. Zinc picolinate is the most bioavailable type of zinc, picolinate. Let me type a message in. And yes, I mean, certainly we are interviewing a second IV nurse. So if for some reason we have pent up demand and there's too many patients for Laura to handle, then we could bring another nurse on, and we have that kind of waiting in the wings there, her there. So thank you, Mustafa. Let me see if I answered. Yes, Evelyn. So when you reopen, will you have rapid testing so that asymptomatic carriers can be identified? Yeah, so that's the point of the rapid testing. So if a lot of people are interested in that, I've ordered some kits, but I might order some more based on the responses today. we're going to be testing anyone that would like to be tested. So we want them, they would most likely be asymptomatic. We don't actually, at this point, we're not like an urgent care center. We're not set up for that. So if you do have COVID symptoms like shortness of breath, fever, and things like that, we're going to recommend you go to urgent care, not come to us at this point for rapid testing. So I think it would really be more for the asymptomatic carriers, so that you know that. Suzanne asks, if I had COVID, would the regular test indicate if you had COVID or not now that I'm recovered? Yes, so it should, if you have a robust immune system, which I'm assuming you do, that yes, it would tell you if you had an IgG response, if your immune system was responded. Now, like I said, does it mean that you definitely are immune to it? I think there's no way to prove that yet. There's not the studies that are out there. It's so new, but in theory, yes, you would have some protection, Yeah, rapid testing, yeah. So we'll probably be getting a lot of rapid testing. Thank you, Ellen. So end polling, I'm going to share results. So most people want blood work, 82%. 50% want IV therapy, which is a pretty good amount of people there. And then 27% acupuncture, 27% body work, that's still a good amount. And then less people want sauna, red light therapy, and the brain mapping. So we will definitely take those into consideration. I definitely thought that these would be this is pretty much what I predicted here, but it's good to hear that feedback from people, and certainly blood work and IV. And I know our acupuncturists are also going to be opening up as well, and they'll contact you more directly about that also. So I will, let's see, stop share results, okay. Okay, so another question, are you okay with nutrition consults? Oh, I have to, so let's see. I think, can you go back to I think there's another question on the 6-week group program. I'm not sure if we did that one yet. Jen, I'm not sure if we did that one yet. Yeah, okay, thanks. Okay, so one of the things, one of the initiatives that we realize is that we have to take this by the horns. We have to take this bull by the horns. So we can't just like sit back like passive observers with COVID and let COVID decide what we're doing. We have to actually take charge of our own health. So you are the chief executive officer, CEO of your own health. So we are going to be launching this initiative, this program where we can bill so that insurance actually starts paying for healthcare, not disease care only, right? So we are going to launch a 6-week program if people are interested in what's called Total Body Health that covers 6 major areas of health: immune system, gut, cardiovascular, hormone, detox, and energy. We'll probably do this on Zoom and, have a way to do that and bill that to insurance. And I guess one small silver lining to all this is that this wouldn't have been possible pre-COVID. This is something now that insurance is allowing us to do, insurance-based group telehealth visits, insurance-based individual telehealth visits. Suzanne asked about Pennsylvania. Thank you, first of all, for driving from Pennsylvania to see us, Suzanne. Yes, and it is truly amazing. I agree, and I think Medicare is doing their part, so we thank them for that. So yes, I would say because Medicare, they've loosened the rules right now, and we can I believe treat people across all 50 states with Medicare right now based on that. So I think you'd be fine with that actually. We can help people with telehealth that have the virus through telehealth. Yes, Jackie, thank you. So end polling. I think actually I'll share results. So, well, thank you very much. That's very nice, and I like those results in terms of I think people are at least maybe interested. 19% and 81% are definitely interested, which I think is amazing. That's awesome. Thank you for your interest, and I think it's all about taking charge of your own health, and this is a way to do that, to empower you to do that. And so, really, 100% of people are at least interested, and most people are very interested. So, thank you. Let's see, so I'm going to go to the next. So the next question, we can go to that, Jen, is are you okay with nutrition consults? Here, people with Lyme, I don't think that's technically considered immunocompromised, but certainly with low CD57 counts, you would want to try to boost the natural killer cells. So I think that would be a factor. How does the guidance to reduce cell-free hemoglobin impact patients with hypochromia? I will have to get back to you on that a little bit. I can, if you email, let's see, who would you email here? You can email info at and ask that question there, and I'll get back to you. Sjogrens, yeah, I think that would not necessarily be considered technically immunocompromised the way that others would. Oregano and herbs, we'll talk more privately about that. I think there's a lot there with that. Garlic, I'm not sure about garlic and Alamed, if that would help with COVID. I mean, garlic is considered antiviral. I haven't seen anything on garlic and COVID yet, though. Thanks, Jennifer, for the question. IV would help with Sjogren's or other immune conditions depending on what's causing the immune condition. If it's caused by Epstein-Barr, if it's caused by nutrient deficiencies or mitochondrial issues, then it would. Najwa, hey, how are you doing? Great to see you. My brother-in-law believes in curcumin. No, I think curcumin is great. Curcumin has antimicrobial effects also. No, I don't think the immune system becomes dependent on that. Neo40 will help high blood pressure by increasing nitric oxide, is basically how that works. Yes, sodium ascorbate is a good type of vitamin C. Yes, it is. There's ascorbic acid and there's sodium ascorbate. I think that ascorbic acid, pure ascorbic acid, is probably a little stronger based on the studies, but I think both are good. Elizabeth, I don't know if there's a way to measure virus particles in an enclosed space. I mean, hopefully there's a microbiologist in the audience that can answer that question. Could wind? Yes, and wind could make airborne particles more contagious. That is one concern for sure. Let's see, I wanna make sure we got to all the poll results. So we're gonna, so most people are okay with nutrition. In telehealth version, you can still use the Embody in the office, absolutely. And certainly we are gonna have in-person available as well. So we'll have both options. Are we up to question 5? I think we have to do these other 2 questions. So I don't know if they're on the slides or I can just share it with people.
You can just share them.
Share, yep, okay. So this is very exciting. A very exciting development this week is that we are going to be partnering with Dr. Hiza, who's a friend of mine. He's a physical therapist, and he's amazing. If people have been with him before, said, I have one patient that said that they've been working with PTs and doctors that know this stuff for 20 years, and he's the real deal, which I can attest to as well. He's helped me out a lot. We go hiking together sometimes, but I'm going to be his patient too, I think, just in terms of, making sure I'm flexible and just staying healthy and all that. And, he and I will kind of work together to get physical therapy, holistic physical therapy. And this is amazing, covered by insurance, which I think is going to be a great benefit for all of you all that are interested or that need that. So certainly there's different ways to do physical therapy. There's different ways to deal with the structural aspect of health. If the structural aspect of health is not well optimized, and that affects all the rest of your health, really. So, including the immune system. So I would say very beneficial for most people. And he's been doing telehealth now in his practice for a while, and very experienced with that. So, so I would say I'm gonna end the polling here and give you another 30 seconds. Thank you for voting again. Thank you for your time and for staying on this call as well. Really appreciate it. I know your time is valuable. You're probably busy with work or kids or other obligations you have to do. So really appreciate and I'm grateful for you spending time with us here today. All right, so I'm gonna end polling. Share results. So let's see, 90, that's pretty good. 96%, is that right? Are interested? 99%? I don't think the math adds up, but 103%, but 54% very interested and 45% maybe interested. So those are good numbers. I'm gonna relaunch polling. So thank you for the input there. So over 90% are interested. Do you want to continue? Yes. Okay. So let's go to the next question. How interested are you in drop shipping supplements from our clinic? That's another thing that we haven't done in the past before, but I think because of COVID-19, I think we want to keep offering that to the patients. We've started to do a little bit of that now, but do you want that to be a long-term option for you? Thank you, Suzanne. I really appreciate the kind words. And I don't know of a resource, Deborah, in the DC metro area for COVID positive for IV. We can consider that down the line if it continues to be an issue. I think I have been talking to the hospitals about that because ideally that would be done in the hospital in a controlled environment. They haven't been totally receptive yet to that. If you know people high up there, please. There is research that shows from both China and then I think now in clinical practice, Long Island hospitals are doing that. There's a group of like 20 plus hospitals doing that in Long Island, where it's like the epicenter of in New York City or New York City area. They're doing IV vitamin C up there. And it's not a high dose either. It's like 5 to 15 milligrams there. So end polling. Hey, Olivia, great to see you. Olivia from Smile. Great to see you. And thank you so much for coming. We did share the discount code with our patients, 20% off for Smile Herbs, and we're going to be working together on a special coronavirus herb protocol as well. Thank you, Laura, so much, and for the kind words also. We're going to keep doing this. I think this is a great way to connect with everyone and with each other here. I mean, this is great. So thank you, Sarah, also. Thank you so much. So I'm going to end polling. Yeah, I'll get to some other questions. So let me share results. So most people are interested, about 71% are interested in drop shipping supplements and then 24% maybe. So thank you so much. I'm looking forward to it as well. Thank you so much, Olivia. I'm really looking forward to it and grateful for that. And yeah, it's great to see you. And then we'll talk in person, I'm sure at some point when everything is less chaotic on that. But yeah, I'm really happy to see you on that. So I'm gonna go to yeah. I mean, I would say, yeah. If I would definitely, Deborah. You could have your family. Love to see them. We can actually see telehealth patients that are new patients. Thank you, Jackie. Really appreciate it. Sharif, in the absence of IV vitamin C, how much oral? Yeah, I mean, I would say if you're not symptomatic, if you are symptomatic, 5-10 grams a day in divided doses at least, but come talk to us. We can see you on video now, and we're able to do that via telehealth. So we're having our next town hall Thursday on April 23rd. And the link will be shared via email, Facebook, and Instagram. So we look forward to seeing you here same time, same day on Thursday. You can visit our Facebook page and Instagram, which Jen is doing a great job updating, and we're kind of communicating with people on there too. So we'd love to hear from you there. The SBI Protect is what SM wanted to know about that. That's a great, and that has been around for a couple of years now. They started that in 2018. That's a great product. You're very welcome. All right, so it's 1 o'clock and they are going to be, thank you so much. Thank you, Margaret. Connie, yes, we are going to record them, or they are being recorded. And we're going to post that to our Facebook page. Yes, there's a few more people talking about these things. The insurance-based lab test we'll have hopefully there's some back order on it, but we're gonna hopefully have that in about 2 weeks or so. Hey Sharon, great to see you on the call as well. Thank you, Christina, as well for the kind comments. We're gonna keep doing these. This is a lot of fun and a lot of fun connecting with everyone. And thank you, Yolanda. Thank you, Stacy. Thank you, Regine, so much. Hope everyone stays safe and healthy and spend some quality time with your family either in person, family and friends in person or on virtually. You know, important to stay connected to community. And thank you, Maria and Joanne and Ellen and Deborah. So we will see you all soon, and we'll see you next week. Oh, okay. So I will. One other question. So if antibodies are not conclusive on immunity, yes. Well, that is I think we just have to not let the, what's that saying? Let the perfect be the enemy of the good, you know, so if you know what I mean. Thank you, Angela, so much. We love you too. Thank you so much. In terms of Christina's question, that's a great question, first of all. The studies are just not out there to prove that, you know. I think given that 75% of people have a robust response or maybe more, if you're generally healthy, if you have a robust response, if you had symptoms, it's likely that you have developed some degree of immunity. How long that lasts for is the question. It may last for 1 or 2 years based on other similar coronavirus studies, SARS-1 studies and things like that. So, you know, these tests are not conclusive that you're going to be immune to it, but they're more suggestive than not that you will. And so these are the best tests we have out there, you know, like that. You can also, if the antibodies are positive, then usually what we'd do is follow up with a nasal swab. You know, so if your antibodies are positive, you're not symptomatic, and nasal swab's negative, then I think you're immune to that. I don't know about dogs. I hope there's some dog experts in here. Can dogs carry the virus on their coat? I assume so. I mean, viruses will stick on different surfaces, so I'm assuming so, but I honestly don't know the answer to that question. Yeah, and thank you to anyone on the front lines. You know, stay safe and healthy, and thank you so much. And you know, everyone's doing their part to help in this way, and we're all in this together. So we will see you next week, and have a great week, everyone. Thank you so much.